Buoy Health Insights, Regurgitation. Hello, and welcome to another episode of Buoy Health Insights. Today we'll dive into a condition many might find uncomfortable, but which is important to understand: regurgitation. If you've ever experienced a sudden taste of stomach acid, food, or bile in your mouth, without the typical sensations of nausea or cramping, you might have encountered regurgitation. Regurgitation happens when contents from your stomach make an unwelcome return visit to your mouth. You might not even realize it's happening until you taste or feel it. This can be a result of eating too quickly, consuming too much, or due to increased pressure in the abdomen if you're pregnant or overweight. While regurgitation can be an unpleasant sensation, the good news is it's usually not hazardous to your health. However, understanding its potential causes and accompanying symptoms can help you manage or even prevent it. Let's look at some potential causes and what other symptoms might signal that cause as well. The first culprit could be gastroesophageal reflux disease, commonly known as GERD. This occurs when the muscle sphincter between your esophagus and stomach doesn't close properly, allowing stomach acid to move upward. Symptoms can include a burning sensation in the upper abdomen, irritation in your throat or chest, retching, nausea, and that unmistakable heartburn. Another potential cause is gastric distension, which happens primarily when you eat or drink excessively or too quickly. Spicy, fried, greasy foods, alcohol, or carbonated beverages can worsen symptoms. Feeling bloated or uncomfortably full are common signs. Light activity or antacids might help if overeating is the issue. Peptic ulcers are also to blame at times. These ulcers are essentially sores that develop on the lining of your stomach or small intestines, typically due to a bacterial infection or overuse of certain medications, like ibuprofen or naproxen. Symptoms might include burning pain in the upper abdomen that worsens after eating, loss of appetite, nausea, bloating, or belching. Treatments often include medications that reduce acid production and give your stomach lining a chance to heal. Sometimes antibiotics are also needed. If you're overweight or pregnant, you might also face regurgitation issues due to the increased pressure in your abdomen. You might feel full faster and experience regurgitation when eating too much or lying down soon after a meal. Smaller meals, avoiding trigger foods, and not lying down soon after eating can be helpful strategies. Now let's talk about anatomical issues such as esophageal stricture, hiatal hernia, or motility disorders. These structural problems can interrupt normal swallowing or cause food to get stuck. This may be due to genetic defects, inflammation, or other health complications, and typically requires medical interventions. And lastly, rumination syndrome, though rare, can cause regurgitation. It's more commonly seen in infants and individuals with developmental disabilities. Symptoms, which occur almost daily, are due to involuntary muscle contractions. Treatments vary, but managing this syndrome often includes supportive care, education on feeding, and behavioral therapy. If you're experiencing regurgitation, it's crucial to pay attention to these accompanying symptoms to get a better understanding of the potential cause. And remember, if regurgitation is causing you significant discomfort, or if you're experiencing it frequently, it may be time to seek medical care. For immediate concerns, especially if regurgitation is paired with severe symptoms like difficulty breathing, intense chest pain, or if it disrupts your daily life, don't hesitate to visit your doctor or an emergency room for further evaluation. That's it for today's insightful discussion on regurgitation. If you found this information helpful, consider giving us a like and don't forget to subscribe for more health insights. Thank you for watching and take care.